Hello, everyone. Thanks for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the Department of Psychiatry, the University of Iowa Hospitals and Clinics COPE team, and the University of Iowa Employee Assistance Program. I am your facilitator, Dr. Laura Fuller from the Department of Psychiatry. I have important information to share about this program. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you may have a medical emergency, call 911 or go to your nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties, express or implied, with respect to the information provided herein or to its use. Okay, we are excited that you've joined us today. If you're watching the live stream version of this program, there will be time for a limited number of questions at the end. Please use the chat function to submit your questions. A recording of this webinar and further resources will be available at the Loop on the hospital website. Our presenter today is Heidi Schmitt, LISW, from the Counseling Service at the University of Iowa. The topic for today is using your wise mind to accept, ACCEPT, and she'll tell you what that means during COVID-19. During her presentation, Heidi will draw upon her expertise in dialectical behavior therapy. She will teach us about how to access that balanced thinking between our rational mind and our emotional mind, and how to deploy a specific set of skills for distress tolerance. Here to tell you more without further ado is Heidi Schmitt.
Thank you for that introduction. I'm very excited to be here today, and I have kind of this presentation on the DBT accept skills. The accept skills are a set of part of the distress tolerance skills from Dr. Marshall Linehan's DBT skills manual. So just kind of what we're going to talk about today is, first, I want to talk a little bit about mindfulness, how we can access and use our mindfulness, and how that really relates to distress tolerance, and more specifically, the accept skills. As we talk about distress tolerance and the accept skills, what I want us to remember is that any anxiety, fear, any emotions that you're having right now are normal and they're totally expected. We're kind of living through a time of uncertainty, and for you to feel uncertain or overwhelmed, or again, just any emotion, that's normal and totally expected. I think as we go through this, though, often it's an inclination to fight these feelings, to kind of push them away, and to try not to feel the feelings. And as we do this, what mindfulness would say is ignoring our feelings, not feeling our feelings, is simply going to more intensify them. So getting into mindfulness just a little bit, mindfulness is one of the key foundations of dialectic behavioral therapy, DBT. One of my favorite definitions of mindfulness is from Jon Kabat-Zinn, and it's simply paying attention on purpose without judgment to what is happening right here, right now. And looking at that definition, I think one of the important pieces is paying attention on purpose, doing this purposefully, noticing what's happening within us, noticing our emotions purposefully, to not push them away, to feel comfortable sitting with our emotions, even if they're uncomfortable, to help us find balance, to find that wise mind. Often when I think about mindfulness and sitting with that uncomfortable emotion, I think about an example of like a volcano. And the more we push away our emotions, and they're just going to build up and build up and build up. And often what happens is then there's kind of this explosion. And if we let off a little bit of steam, let ourselves notice our emotions and sit with them, then we're going to see those emotions maybe staying just a little more stable, a little less explosive. And we know that as we're feeling these emotions, there's going to be times where it's more important or necessary for us to pay attention to something else in that moment. And that's okay. So, like if you're driving, that may be a time when you need to be mindful on driving, not on letting yourself feel that anger. But then I think that's when it's important to be able to maybe come back to that anger and let ourselves feel that when it's a safe time to do so. And knowing that there's going to be times maybe when we need to distract ourselves. We need to use that distress tolerance, which we're talking about in just a little bit, but in more detail. But just distracting ourselves to effectively manage our emotions. So as we go through this, I think the most important thing to remember is to do what works for you to be most effective in the situation. When we think about distress tolerance, especially distress tolerance as it relates to mindfulness, distress tolerance is our ability to manage feelings in response to stress. It's the ability to tolerate and survive crises without making things worse. That's a direct quote from Dr. Marshall Linehan's DBT skills training handout. And I really like that quote because I think there's times where we all have to kind of ride this wave of a crisis. We all have stress, distress, we all have strong emotions. And it's okay to feel those emotions. It's okay to have those emotions, but we have to be able to tolerate and act in a way that's going to be most effective and balanced, and that's going to help us move forward in response to that crisis. So often, as we're kind of moving through these distress tolerance skills and learning them, distraction techniques are a big part of that. Distraction techniques, they're going to help us to engage in activities that are going to distract us, that are going to require our full attention to help us tolerate some of those distressing emotions. We're not going to ignore our emotions. We're still being mindful and recognizing them. But what we're doing is letting our attention, we're choosing to shift our attention to something that's going to be more effective, that's going to let us ride this wave. The goal is not to add to your distress, but to provide yourself with a sense of perspective. And sometimes just taking that step back, distracting ourselves, using distress tolerance, that's going to help us to find that sense of perspective. Another quote that you're gonna hear a lot about this over the next few minutes is from Jon Kabat-Zinn, and I think it's particularly applicable now, knowing that you can't stop the waves, but you can learn to surf. We can't stop our feelings. Our feelings are our feelings, and they're there, and that's okay. But we can learn to manage and cope and be effective. So as we move into the accept skills, an example, I think about the accept skills and learning to ride that wave. I was watching a YouTube video the other day, and it was titled like The Biggest Wave. And it was these surfers that were riding this huge wave. And I don't surf, but I've seen, these surfers riding the wave. And if I had this huge wave behind me, I probably would have been totally panicked. But they looked calm. They looked focused. And they were able to kind of ride that wave to safety. And I think they were probably still feeling panic. They were still feeling those emotions within them. But they were able to choose to have their attention on something that was able to help them move through the wave. And that's where we want to be able to choose how we're going to cope and manage through that wave. So I just want you to keep that, that idea in mind as we talk about the accept skills. And so as we go through the accept skills, accepts is, like I said, distress tolerance. It incorporates mindfulness, and it stands for activities, contributing, comparisons, emotions, pushing away, thoughts, and sensations. And now you're going to notice there's not a slide that has that kind of spelled out during this presentation. And I kind of did that purposefully because as we go through this, I want you to really focus on the spirit over the overall skill rather than on the specific letter. And so noticing themes as we go through this skill, and I think the kind of the three themes that I've pulled out are: how are you going to use your five senses? How do you use movement? And how are you creating the opposite emotion within each part of this skill to help you to tolerate distress, to help you to be mindful in the moment and choose where you want your attention and choose how you're going to cope so that you're managing the crisis and being most effective in your life. So I'm going to kind of shift and we're going to move into the accept skills, and I'm going to talk specifically through each one, give examples, and then some ideas about how you can further practice them. So I want to talk a little bit about activities first. And activities, really, this can be tasks. You're going to choose a task. Choose maybe a TV show or exercise, music. Choose a task that's going to help you shift your attention and really have your complete attention. Maybe it's a puzzle or spending time with a friend. You want it to be something where you're not going to have kind of a wandering mind. You're going to use your mindfulness during this activity to shift your attention and choose. And so maybe it's music. And for this music, choose music that's going to help you create that opposite emotion. So if you're angry, don't listen to angry music. Listen to maybe happy or soothing music. And make a playlist ahead of time. Plan ahead with the activities. So if a puzzle is something that you're going to choose, have the puzzle. Don't wait till a crisis to say, oh my goodness, I need to go to Walmart and I need to buy this puzzle so that I can do this. Have a puzzle ahead of time. Have the playlist ahead of time. Have it all set up so that when you need it during that crisis, you can go to it. The next letter in accepts is contributing. And think about this as contributing to yourself or someone else to, again, cultivate that different emotion. So the examples in the DBT curriculum that they give are something like volunteering, helping someone else, a loving kindness meditation. Those are really, really great. Simply saying hi to someone else or doing something kind. These don't have to be anything big. They don't have to cost money. They can be really, really small things. But what you want to do is to be able to contribute in such a way that you're kind of bolstering yourself up. You're helping yourself to feel good. And so, I think about simply saying hi to someone on the sidewalk or holding a door for someone. Sometimes, like if I'm having not such a great day, I'll maybe take my dog for an extra walk. That's going to make my dog really, really happy, which then is going to help me to feel good about myself because I've made someone else feel happy. So contributing to someone else to help you contribute to yourself. Moving on to comparisons. So when we think about comparisons, this is one where you can really compare how you feel now to how you felt at a different time. Being mindful about maybe a time where you feel worse than you did now. And then think about, how did you get through that time? How did you cope? What helped you to move through that crisis? You could think about maybe comparing yourself to others, and again, helping to create that opposite emotion. So when I think about comparing, maybe I think about, so I'm not having such a great day today. I am really stressed and I'm really overwhelmed. But then I could think about, well, last week I didn't have such a great day either, and I was really overwhelmed. But I maybe made this list of things that I needed to do, and then I went for a walk. And that seemed to help. And so maybe if that helped then, maybe it's going to help now. And so by looking at that comparison, we can help to cultivate these feelings and help us to notice, be mindful of what we can do to change our emotions, ride that wave, and move ourselves through the crisis, acting in a way that's going to be most effective. And like I said earlier, to help us move through so that we're not making the crisis worse. As we move through these, what I want you to notice is that a lot of the different skills embedded in each one of these are very similar. So as we talk about emotions, one of the examples of changing our emotions and cultivating different emotions, that's really what this skill is cultivating a different emotion, is listening to music. Often we use music to cultivate different emotions. And so you can think about that in terms of, like I said earlier, if you're angry, don't listen to anger music. Listen to something happy or soothing. If you're feeling maybe really low, watch a movie that's going to make you feel happy. Read a happy book or tell a joke. And you can plan ahead with these emotions. You can plan ahead with any of these skills. But planning ahead with your emotions maybe is having a picture ready to go on your phone. Something that you look at that picture and it's going to make you feel really happy. It's going to make you feel good. And the more you have that planned ahead, then during that crisis, it's going to be easier to ride the wave and turn to that specific kind of activity or task. So the other one that they give as part of emotions, and that I see this a lot as I'm practicing this skill, is like jokes and like joke books. So you can have that planned ahead as well. I have a joke for you today, and it's a super corny joke, but it makes me laugh a lot. So it's raining cats and dogs. Make sure you don't step in a poodle. And that's a super corny joke. I recognize not a great one, but it makes me laugh. I have 2 poodles, and so I can connect to that emotionally. And if I'm having not such a great day or going through a crisis, then I can read that joke, and it's really going to help ground me, feel a little bit more mindful, and maybe change that emotion. So think about, for you, what are the different things that you can do to change your emotions? These are all just different examples, but like I said, you can figure out what's going to work for you, what's going to be most effective for you, and try that. Try lots of different things within this. The next one is pushing away. So pushing away, maybe that means pushing away some thoughts, pushing away some feelings temporarily. Like I said earlier, we don't want to push things away forever. We don't want to ignore our feelings. But sometimes maybe we need to push away or leave the situation temporarily to then come back and more effectively handle it in the future. So maybe pushing away means going for a walk. Maybe it means going and noticing some of your thoughts, being mindful of your thoughts or your feelings, and yelling into a pillow for a little bit. And then being able to come back to the situation later when you're not necessarily riding that wave through the crisis. And I think one of the things with pushing away that maybe makes this most helpful, especially if the pushing away for you is going to be leaving a situation, is that maybe you can plan that ahead. So thinking about if you're going to push away during a conflict with a partner, letting them know ahead of time what you're going to do. That comes back into that planning that we've talked about. And just letting your partner know at a time when it's not a crisis, but that like, hey, if I get overwhelmed, I might walk away, I might go take a walk, but then I'm going to come back. So it's going to help me more effectively manage my emotions and really have that plan in place. Think about what you can do to plan that ahead, especially if you're leaving a situation, and making sure, however you're doing any of these, that you're doing them in a really emotionally and physically safe manner. Our next skill is T, so thoughts. And again, you're going to see some overlap with these. The thoughts, the activities, your sensations, they're all very similar. And so thoughts, this is where you are really shifting your focus. You're using that mindfulness to be purposeful, to choose what you're going to think about. So maybe this is counting to 10, or maybe it's counting to 1,000, counting colors, counting anything, and being purposeful that with whatever you're doing, that you're keeping your attention, you're being mindful with your attention on that task. Same thing, we talked about puzzles earlier. If you're doing the puzzle, then do the puzzle. Don't continue to ruminate maybe on the emotion or the crisis. Make a conscious choice to, in that moment, do your puzzle. Or to color. Adult coloring books are super popular now, so maybe do a coloring book. Or choose to do a complicated task. Do something that's going to effectively take over your attention in that moment. And what I want you to do is to really notice how you, during this, you need to be mindful and be purposeful with it. This isn't always easy during a crisis. And knowing that you may need to do more than one of these different coping skills as you're riding that wave. Maybe you need to do a puzzle. Then maybe you need to go for a walk. That's okay. You can keep doing as many as you need to as you're riding that wave. That's totally fine. This last one is sensations. And so with sensations, maybe that's really using your 5 senses. That's being mindful, and maybe it's squeezing a stress ball, or listening again to music, something loud, something soft, something to cultivate that opposite emotion. It could be going outside, going for a walk like we've talked about, but as you're going for a walk, choose something to specifically shift your attention to. So maybe it's looking at the colors, looking at the leaves. Maybe it's noticing how that wind feels. It could be taking a shower, warm or cool. Holding ice in your hand or mouth. Again, don't do anything that's physically painful or harmful, but just helping to shift your focus or your attention. Lotion. I think a lot of these are things that we often have with us. So like I have this bottle of lotion here. I always have this on my desk. So it's part of that preparation that we had talked about. Like you can prepare with these skills ahead of time so that when it's a crisis, you're able to use those and really be mindful as to how you're doing that. And I think my last thing that I typically recommend with sensations is maybe drinking something cold. That's going to help to cool you down. It's going to give you just a few moments to take some of those deep breaths and then really focus your attention on to those cold sensations. What does that water feel like as it goes down your throat? How does it make your lips feel? Notice all of those feelings. Maybe if you're drinking something cold, it has a specific flavor or a taste. Really notice that. So those are the accept skills. And so just very briefly, I want to talk about how you can practice this a little bit further. And so really my one big recommendation with this is to plan ahead. Make a coping skills kit with different things in it. So maybe that's the lotion. Maybe that's a puzzle. Plan it ahead so that you have it. And then make sure that you have these things ready so that you can practice when you're not in crisis. Because if you're only practicing when you're in crisis, that's probably not going to be as effective as if you were practicing all of the time. So thank you for letting me share a little bit about the accept skills.
Thank you so much, Heidi. That was very informative, and I really like how you went through all of the accept skills, but also kind of gave us some general themes to pay attention to, because I think we all probably forget in the moment to use our senses and to use movement and to use kind of that idea of opposite emotion.
Yeah.
So thank you very much. So a question that I had was if you could tell us more about that whole idea of opposite emotion. I know there's a whole literature on it. I've seen Marsha Linehan talk about it, but can you tell us a little more about
So just
opposite
really
emotion?
briefly, because you're right, there's the whole big literature with it. Really what opposite emotion is you're trying to cultivate or create that opposite emotion. So if you're already feeling angry, I think our tendency is to sit with that anger. It's maybe to do something that's going to create more anger. So like I said, listening to that loud music or driving fast. But that's going to really embed us in that same emotion. So being purposeful to choose something that's going to create maybe a different emotion. So maybe it's listening to something really soothing. Sometimes if I'm trying to create an opposite emotion, I'll listen to like Disney music. It's really hard to be angry while you're listening to Beauty and the Beast. So really making a conscious choice, a mindful choice that I'm going to shift from this emotion to create this other emotion.
Right. Yeah. Thank you. So that definitely gets at the whole heart of DBT as being the dialectic, having opposite things that can be true at the same time.
Absolutely.
Yeah, as I've learned about some of these concepts, I've always really loved the idea of riding the wave. The fact that we can be in a very intense place with our emotion, but then if we can zoom back and picture ourselves as someone who's riding a wave that's not going to stay high and threatening forever, and the idea of learning to surf, that's just so awesome.
Yeah, so it's one of my favorite things.
Yeah. Can you talk a little bit also about, I know you work at the University Counseling Service. Do you think that these concepts that you're talking about are kind of universally applicable right now, whether you're a hospital employee or a university student or a teacher who's not able to go back to the classroom this year or whatever?
Yeah, I think absolutely. These can be used by anyone. So I work at university counseling now, but I spent a lot of time working in community mental health before I was at the university. And these are skills that I've taught to little kids all the way up to doctors and lots of different people. I think we can use these. I use these personally. I have a 1-year-old at home and we have that playlist skill, and we definitely use that at times when he's having distress and uncomfortable, and finding what's going to work for him. So I think you can even apply it at home with your kids.
Yes, I work with kids too, and I've recommended a million times that people put together a stress box and have something that helps them engage their senses and distract them in healthy ways.
Yeah, absolutely.
Yeah. So that's it for our time today. We want to thank you very much for helping us think of some practical steps that we can all take to respond to the coronavirus. So thank you, Heidi Schmitt. A recording. Oh, sorry. Yes. A recording of today's live stream, as well as links to additional resources related to this topic, will be included on the loop later today. Next time, we will be joined by Dr. Allison Lynch and Kathleen Huizinga, who will be discussing substance use and recovery during COVID-19. Until then, take care, and we look forward to seeing you soon. Bye-bye.